On April 13th, President Obama outlined his long-term fiscal vision for the nation. His plan aims to cut $4 trillion over 12 years by trimming many federal programs, revamping health care laws to drive greater efficiency, eliminating tax credits and deductions, and letting the Bush tax cuts expire for top earners. 2 days later, House Republicans passed a budget resolution that aims to cut $6 trillion over 10 years. In this video, 3 Urban Institute experts unpack the president's proposal and compare it to the House Republicans' plan.
Today I'm proposing a more balanced approach to achieve $4 trillion in deficit reduction over 12 years. It's an approach that borrows from the recommendations of the Bipartisan Fiscal Commission that I appointed last year, and it builds on the roughly $1 trillion in deficit reduction I already proposed in my 2012 budget. It's an approach that puts every kind of spending on the table.
The President's proposal to cut $4 trillion from the deficit involves doing 3 different things. One is cutting spending by about $2 trillion, focusing primarily on health care, but looking throughout the entire budget for cuts. Another $1 trillion comes from reducing the interest we pay on our national debt. And the fourth piece, the $4 trillion, would come from taxes. He'd want to reform the tax system, focusing primarily increased taxes on the wealthy. The President's plan differs from the House budget resolution in that the President would raise a substantial amount of funding from additional taxes. The House budget resolution would raise no additional taxes and in fact constrain the level of taxes to no more than 18 or 19% of GDP over into the future. The President's plan would increase taxes, focusing primarily on the wealthy.
The President, just like the Republicans in Congress, is making a stance, and he's putting forward several things. One, he's claiming that he is now going to tackle the deficit issue in a much bigger way. B, he's saying that he's going to protect the middle class from certain things, such as certain health cost savings. Whereas the Republicans are saying they're going to save the middle class and others from tax increases. What's really different today, and I think is being ignored, is that the debate has totally changed. If you were talking about a year ago, we were mainly talking about who was going to give away more money, who was going to spend more to deal with the recession, who was going to enact the next set of tax cuts. And as we had been throughout actually the first decade of the 21st century, we were mainly on what I call the giveaway side of the budget. Tax cuts, spending increases. What has happened now and is quite significant is that both Republicans and the President are now competing over how they're going to do deficit reduction. They're both afraid at some levels to ask or tell the middle class that they're going to have to give up very much, but it is a very, very different debate than we had even 1 year ago. One thing I do worry about in all of these proposals is that they're presented at a very broad level of generality. And I think in many cases the issues are highly complex and really require extremely good analysis of what's possible.
Now, we believe the reforms we've proposed to strengthen Medicare and Medicaid will enable us to keep these commitments to our citizens while saving us $500 billion by 2023, and an additional $1 trillion in the decade after that. But if we're wrong, and Medicare costs rise faster than we expect, then this approach will give the Independent Commission the authority to make additional savings by further improving Medicare.
The difference between what Chairman Ryan has proposed and what the President has proposed is enormous. Chairman Ryan has basically said, let's limit the amount of money that the federal government is going to spend on Medicare and Medicaid, and let's leave it to other people to figure out how to achieve the savings. For Medicare, let's turn it into essentially a voucher, and let's leave it to the individual senior to go out and shop and find a good insurance plan that will best meet that senior's needs. And the federal funding that goes along with that voucher is going to decline relative to healthcare costs over time. So that means seniors will have to be smarter and smarter about how they figure out where to cut their healthcare spending. On the Medicaid side, Chairman Ryan's proposal would say the federal government is going to cut what it is expected to spend on Medicaid, turn the money over to the states, and let them figure out where to achieve the savings. So that's how one way to characterize the Ryan approach. The Obama approach is to say that the federal government needs to maintain the existing structure of these programs, which includes federal guarantees of coverage for Medicare and Medicaid individuals who qualify for help. And if we need to achieve savings, let's do a better job of managing the program, but let's not just cut the federal dollars and make somebody else responsible for figuring out how to achieve the savings. Let's take responsibility at the federal level for making the policy changes that will achieve the savings that we want. On the Medicare side, the president's proposal would permit Medicare to negotiate with drug companies to get better prices on prescription drugs. And there's no question that would save a lot of money, but whether it can pass Congress is a different question entirely. The president would also take the independent commission established under national health reform and give it additional powers and give it a tougher charge. Over on the Medicaid side, the president has some interesting proposals. One proposal would cut back on states' ability to game the system by putting faux taxes on healthcare providers, using the tax revenues to draw down federal Medicaid dollars and then returning those tax payments to the providers along with Medicaid payments. It's been some states have been very clever at gaming the system. A lot of smart people out there in state capitals, and the president would cut back on that ability, on that loophole in current law. He would also take some existing Medicaid cost savings measures, so-called upper payment limit, and apply it to new categories of service. Durable medical equipment, wheelchairs and such, that would certainly be able to achieve savings.
The president has proposed a number of ways to improve efficiency of health care. So far, those proposals have not been scored by groups such as the Congressional Budget Office as saving a great deal of money. They save some, but they in no way get these health systems under control. And one of the main reasons is because they often operate without a budget constraint. So let me give an example from my own experience. I worked for several years on a Health and Human Services committee that was very strongly supporting adoption of healthcare technology, health information technology, basically computer records of your of your procedures, your diseases, your treatments, and so on and so forth. Doctors, for the most part, in the past have had very little incentive to adopt such procedures. I remember one doctor told me, why should I adopt this procedure when in point of fact, all that's going to do is give the insurance companies more control over what I do and check up on me. So here is one of the richest sectors in our entire economy, the health sector, that is totally behind the eight ball in terms of its use of software and other information technology. Why? Well, because the incentives aren't there. The incentives to operate within a budget or to have people check up on your records are not there. If there is a budget constraint under which a group operates, a group, say, such as Kaiser Permanente in California, or one of the other well-recognized groups that do a pretty good job on cost containment, such as the Mayo Clinic, if they operate with a sort of more of a fixed budget or less of an incentive simply to increase cost, then they actually have an incentive to adopt these efficiency improvements because it can A, help them maintain provider salaries, and it can help them provide better care for consumers. So you need the budget constraint to really push onto the system the incentive to actually adopt these efficiency improvements.
My budget calls for limiting itemized deductions for the wealthiest 2% of Americans. A reform that would reduce the deficit by $320 billion over 10 years. But to reduce the deficit, I believe we should go further. And that's why I'm calling on Congress to reform our individual tax code so that it is fair and simple.
The president's focus on the tax side is raising taxes on the wealthy. His arguments since the 2008 election has been that the middle class and lower income households cannot afford additional taxes. They have not seen their incomes rise over time, whereas the wealthy have seen their incomes rise substantially. Therefore, the President proposes to limit the value of itemized deductions for the wealthy to no more than 28% of what people are deducting. That would increase taxes for anyone who's in the top 3 tax brackets, those tax brackets that have tax rates higher than 25%, and would raise, as he suggests, $320 billion over 10 years. He's looking for $1 trillion, though, so he needs another $700 billion. And where is he going to get that? Well, he follows the Fiscal Commission's plan of reducing tax expenditures, those provisions in the tax code that allow people to reduce their taxable income and therefore reduce taxes directly, or that give them credits against their tax that reduce the final tax bill. He would focus on getting rid of those or limiting them and cutting out a substantial amount of the benefits in the tax system. Every year, we give up about $1.1 trillion of revenues through these various tax expenditures, some of which go to every American, some of which go only to people at the very top of the distribution, some of which go to people at the middle and the bottom. For example, the mortgage interest deduction primarily benefits people in the middle of the income distribution and those up at the top, those people who can afford to buy houses and who have mortgages to pay for them. Various tax credits benefit people at the bottom of the distribution. The child credit benefits middle class and lower income households. The earned income tax credit benefits people at the bottom of the distribution. The American Opportunity Tax Credit that supports education benefits people throughout the income distribution, except at the very top where things are phased out. The President would cut some or all of these to reduce the amount of revenue we give up through tax expenditures. And that's how we'd get the additional $700 billion. The other thing the President said he would not do would be extend one more time the Bush tax cuts, the Bush-era tax cuts for the wealthiest families. The $1 trillion in tax savings he's called for in his budget proposal is beyond that savings, those additional revenues gotten from the wealthy by not extending the Bush-era tax cuts. He would get $300 billion from limiting the value of itemized deductions, and he would look for another $700 billion from reforming the tax code through cutting back on tax expenditures. The biggest lacking in the President's proposal is specifics about which tax expenditures he would cut. He did say he would scrub the tax code trying to find those provisions that are least beneficial or least effective, but he did not say specifically which ones. Presumably he'd focus on those that benefit the wealthy. The big problem with that is, as previous research by the Tax Policy Center has shown, there's just not enough money up there. We'd have to raise taxes too much on the wealthy in order to solve our problems by focusing on them alone.
The President, again, is saying a lot of the right things about reforming a tax code, but one really needs to be much more specific and make trade-offs. I mean, the difficulty that he faces, as well as the Republicans in Congress, is that we're operating with a budget that's basically spending today about $31,000 per household. That's total spending divided by total number of households, and it's collecting about $19,000 in taxes. And that's a huge gap. The gap doesn't go away in the future. And to close that gap is going to require everyone to contribute. And that includes the higher income people, where the President is willing to say he's willing to tax them more. Republicans are saying they won't. But it also includes a lot more lot higher contribution from the middle class, both in terms of less benefit growth into the future, as well as higher taxes are going to pay. And that's where the rubber hits the road, because neither party really wants to go very far in telling the middle class that this world just isn't going to continue as it is now.